This presentation is Collaborative Strategic Planning for Service Alignment from the Workforce Innovation Technical Assistance Center, WINTAC. WIOA, the Workforce Innovation Opportunity Act, signed into law on July 22nd, 2014, is designed to help job seekers access employment, education, training, and support services to succeed in the labor market and to match employers with the skilled workers they need to compete in the global economy. WIOA supersedes Titles I and II of the Workforce Investment Act of 1998 and amends the Wagner-Pfizer Act and the Rehabilitation Act of 1973. The Act requires each state governor to submit a unified or combined plan. Within the plan are goals to be accomplished in a collaborative manner. This presentation addresses best practices for collaborative strategic planning related to service integration of the state's WIOA plan. Hi, I'm Lou Adams. I'm the presenter for this recorded training. I have over 30 years of experience in vocational rehabilitation. My titles have included Bureau Administrator for the State of Michigan's Rehabilitation Services, National Training Director for the Consortia of Administrators for Native American Rehabilitation, CANAR, Organizational Development Consultant and Vocational Rehabilitation Counselor. I am currently the Training and Technical Assistance Manager for National Disability Institute. Our learning objectives for today are to understand the WIOA requirements for service alignment, to gain an operational understanding of the definition of service alignment, to understand the benefits of shared planning and service alignment of American Job Center partner services, differences between standard organizational strategic planning and integrative strategic planning with partners, examples from states using strategic self-assessment and planning for service alignment. The integration continuum and strategic governance at the state level. WIOA requires the state workforce development boards to develop strategies for effectively coordinating programs and services among one-stop partners for job seekers with barriers to employment. The integration continuum model establishes a strategic approach and a measurement for progress. The integration continuum approach demonstrates the dissemination across the core programs of statewide strategies, operational goals, policies, procedures, etc. Career pathways and integrative service competencies are core components of the integration continuum. In the integration continuum model, based on work of Arthur Himmelman, it includes focus on building a collaborative network and consensus building. Consensus building is a process where stakeholders build consensus on actions to address specific public policy concerns. Community vision is a process where members of the community build consensus on descriptions of the community's current state and desired future, and on actions to help make goals for the future a reality. Collaborative network, this system is meant to accomplish more alignment among more communities and their needs, strategies for service agencies, priority outcomes, and resource allocation. It's also meant to accomplish building social capital, integration of human service delivery, and interconnected strategies for relationship building, learning processes, and measurement and modeling among the participants. The integration continuum and strategic governance at the local level. The integration continuum model, which will be shared in a moment, can assist the local workforce development board with creating the process for collaborative local plan and memorandum of understanding and their development. The integration continuum approach is an approach that for the local workforce boards to develop coordinated strategies between core program and service delivery efforts for those seeking employment to employers and or service providers as expected in the law. This can include local workforce development board alignment to create strategies for developing and implementing career pathways. The integration continuum for one-stop certification, implementation, and documentation can demonstrate how The local workforce development board involves core partners, including certification of both comprehensive and affiliate American Job Centers. Assess how well the memorandum of understanding included negotiations on infrastructure cost of one-stop centers in the local area. Career pathways and integrative service competencies are core components of the integration continuum and meets the state workforce board responsibilities to have trained core program staff. It can establish the cross-agency partnership required under WIOA. Competencies include the ability to align local partner efforts around sector strategies, cross-partner integration of career pathway strategies developed by the State Workforce Board and implemented at the local area, creating a collaborative network for the integration of human service delivery, and interconnected strategies for relationship building, learning processes, and measurement. What do your customers experience? Do customers experience a loose association of separate agencies that make referrals to each other? Is service information so complicated that it has customers drinking from a fire hose of information before beginning services that support them in achieving their original purpose for service? Are they getting program-based services, or are they immediately engaged in a progression of functional services that are easy to access in support of their career objectives? In other words, are they coming in and getting services from this title or that title, or are they coming in and getting services based on their needs and their frame of reference? WIOA Partners aligning strategy to align services. According to Ansel and Gash, 2008, collaborative governance involves the government, community, and private sectors communicating with each other and working together to achieve more than one sector could achieve on its own. This is what the WIOA Act calls for, with the core and required partners through a shared vision and through alignment at the state level and local level. WIOA has shared expected outcomes. Outcomes we can agree on. Businesses get the talented workers they need. People continue to work, make more money, and gain skills and credentials to advance in their careers. The American Job Centers capture the unique experience of each partner to meet the needs of job seekers and businesses. These involve having innovative talent development strategies like enhanced sector strategies, coordinated career pathways, strengthening connections between core programs, fresh operational approaches like implementing evidence-based promising practices, use of technology to connect intake case management systems between partners, customer flow or services, customer-centered service design in the American Job Centers. So what exactly is service alignment? Service alignment is a combination of strategies to align and simplify access to client services and supports with the goal of providing the best experience possible. It includes the implementation of a distinctive mix of partner agencies, strategies, and processes based on the resources available, the needs of the client served, and WIOA requirements. Strategic alignment also includes the introduction of innovative practices to core program service systems, such as a positive impact on service delivery policies and procedures, management information, and performance management standards. Do we have multiple labor exchanges? Yes, we do. Unfortunately, this is what tends to happen in many workforce offices in the country. We have Wagner-Pizer, Veteran Services, Vocational Rehabilitation, Title I Adult, Title I Dislocated Workers, SCSEP, which is Senior Services, Senior Employment Services, TANF, CSPG, which is the Community Services, Basic Grant, HUD, and others. So what happens is, as this slide shows, there's a separate labor exchange connected to each separate program to the business, or demand side to the exchange. Separate programs interpret their own guidance to hold them separately accountable for performance and have historically maintained each of their own separate connections with business. Businesses have indicated that this is not an effective way to meet their needs, and it does not support the vision that is described in WIOA. When WIA was signed in 1998 with with its implementation, there was talk of labor exchange. This was the structure for the operation of the job center prior to that act, and represented a good framework for partner agencies on how they operate under WIA. As it was seen then, the labor exchange was like a big tube in which the skills, talents, and aspirations of people living in a community can be matched with the skills needs of a community's industry. The value of this tube of business is greater with greater diversity of skill and ability. The value of this tube for job seekers is greater with greater diversity of opportunity. I'm going to shift gears now and talk about the differences between strategic planning and integrative strategic planning. Because in the development of aligning services for customers between all the core programs, it takes some planning to accomplish. Now, the standard strategic planning that many of us are used to was designed to create a competitive advantage for an organization. Under the integrative strategic planning of working with others, it's designed to create a collective advantage. Under the old way, it was usually done in isolation and then retrofitted to include partners. Thinking and doing are separated. The people that think up the plan aren't necessarily the ones doing the plan. In the integrative strategic planning approach, it's done through collaboration and through a collaborative process and action learning with local partner agencies. So it's done in conjunction rather than in isolation. Under the standard strategic planning, an environmental scan of key organizational issues is done. However, in the integrative strategic planning, environmental scan of key issues affecting all partners and customers and its impact on the system rather than one single organization. Under the standard strategic planning of old, frequently it focused on problem solving. Under this new approach, it's focused on system capacity and system improvement, all of the partners improving together. Strategic planning models were built to guide hierarchical organizations in which a relatively small number of people at the top of the organization did all the thinking, and the rest of the organization did the doing. This process is linear and stable. It assumes that the management level, that things will basically stay the same during the foreseeable future. The economy and the culture that traditional strategic planning grew up out of was the age of industry and standardization. We are now in the age of the internet and the interconnectedness where information and knowledge sharing take place. Yet these command and control mechanisms do not exist in the WIOA environment very well. The real life of most regions involves complex interactions of organizations and personalities that defies simple descriptions and quick analysis. In this space, no small group of leaders can tell anyone else what to do. While strategic planning is primarily analytic, strategic thinking and integrated strategic planning combines analysis with creativity, intuition, and synthesis. This approach to strategy is more flexible and informal, more in line with the rapidly shifting dynamics of the local area. Moving forward together means knowing where we're going. For a local area to decide where they're going, they need to also know where they're at. So it's important that there are shared definitions among partners to accomplish that. These include common customer service goals, common definitions for service outcomes, common definitions for service steps, common understanding of our relationship with one another in terms of customer service, along with a common understanding of where we'd like to be in terms of customer service in the future. Commitment to communicate to customers what we offer as services together to meet the requirements of WIOA. The concept of the continuum. As mentioned in the third slide, the integration continuum model is one that focuses on consensus building in a collaborative network. The reasons for such an approach include the fact that not every system or process can change at the same time. Different core and required partners will be at different stages with others at different times. It's important to recognize the stages of the interaction between core partners so you can determine where you are present and to establish where you want to move on the continuum. Naturally, some elements will be easier to implement than others, and depending on the current connectivity of partners and their individual approaches. And finally, using a self-assessment based on gradients of alignment rather than a binary yes or no assessment of alignment leads to more openness and less defensiveness. Are we collaborating? Levels of collaboration. The levels of collaboration have been shared in other WinTAC presentations and is shared here to reinforce the idea that a multiple choice along a continuum rather than a yes-no, excuse me, pass-fail approach to self-assessment is more conducive to establishing a realistic set point for improvement. The integration stages describe a way to benchmark progress from a situation in which none of the important parties to all of them communicate, up to a point at which all relevant agencies at some or all of their levels, line worker, manager, CEO, accept a new goal, effectively and efficiently develop and administer new resources, and or work at a level of service integration best suited to developing an integrated service delivery. And the American Job Center one stops for the largest number of people in the shortest period of time. The levels of the integration include isolation, in which agencies don't recognize the need to communicate, and there's no attempt to communicate, to the next level of communication where agencies talk to each other, share some information, maybe share resources, information about an upcoming resume workshop or some interviews that will be happening in the building. Coordination, another level, staff from different agencies work together. They might work together on a job fair. They might work together on a class for a business, training for a business. Oftentimes, these are ad hoc and come on a case-by-case basis to coordinate some support. Collaboration, agencies work together on a project-by-project basis, including joint analysis and planning. This could even include case management, where multiple core programs that are serving a specific individual come together with that individual and work on issues and decides which agency will pay for what service and who will be the contact for the person regarding that and how they share information among one another. This level of collaboration goes beyond ad hoc, it goes beyond a case-by-case basis and is a planned approach. Integration is an intensive collaboration. Agencies are interdependent, significant sharing of resources, and high levels of trust, some braiding of funds, and some joint approaches to business services, and a sharing of expertise. Effective strategies for today. Effective strategies answers three questions. Where are we now? Where do we want to be? And how will we get there? Effective strategy is done through a simple process or discipline that can design and guide strategic collaborations quickly, and a collaboration that can move toward measurable outcomes by following a clear pathway while making the inevitable adjustments along the way. Strategic thinking for service integration. Lots of times when partners come together, they have their turf, they have their ways of doing things, and they're not used to involving others. To be effective, we have to answer those three questions. Where are we now? How is the system serving the people it's supposed to serve, both customers and the business customer? Where do we want to be? What areas make sense to improve upon to make our services more integrated, less duplicative, and having better impact for our customers? And how will we get there? Several lessons have emerged from WinTAC's involvement with states. Successful service alignment requires broad-based support. This support depends only partially on facts. Emotions, how people feel about their future, play an equally important role. Leaders cannot generate these positive emotions by fact alone. The presumption that a small group of leaders can design and implement a strategy does not hold in most places. It starts with conversation. Strategies around aligning service require collaboration, and collaboration begins with conversation. WinTAC uses the integration continuum to generate and focus the conversation, with a focus on current levels of alignment, the where we are now question, desired levels of alignment, the where we want to be question. This conversation creates a depth of understanding of the current system of service delivery. Partners learn what each other does in a deeper way, and this can lead to the establishment of common goals for improvement. The AJC, American Job Center, Partners Self-Assessment. The aligned self-assessment provides an environmental scan of key factors for core partners and systems, not just one agency or another. It identifies which partnerships benefit from strategic strengthening and establishes integrative service priorities and operational objectives with a focus on meeting job seeker and business customers' objectives or outcomes. Finally, it establishes a baseline for evaluation and evaluating the progress towards service alignment among the partners. Where are we now? The conversation about where we are now is one of non-judgment and acknowledges there's no right or wrong place to start. Could be at isolation, could be at communication, could be at collaboration, it doesn't matter. It's a non-judgment. It's just looking at things from a systems point of view and jointly deciding where the system is at. Only a common desire to reach a new level of alignment is needed. Core partners will be at different stages on the continuum at different times, as mentioned. In addition, every location has its own unique circumstances, its own history of people getting along or not getting along, its own characteristics, its own partner dynamics, and as I said, a long history oftentimes. The system in place has its own history, reason for being, and momentum. Moving from where we are now to where we want to be takes effort and heart, and it can be done. Where we want to be. Moving to where we want to be includes a conversation on what we can do, what we should do, and what outcomes we need. And agreeing to track progress in the same way allows for us to have alignment and continuous improvement. But what we could do, participants first listen to each other and learn about the assets that could form the basis of a new collaboration. In our groups, we often ask, what do you have to give the partnership and what do you need from the partnership? In this way, they begin to develop a mental map of the assets within their emerging partnership, how they can gain, and how they can contribute. Simply listing assets is not enough, however. Opportunities emerge when participants link their assets across organizational and funding boundaries. Alignment strategies involves making choices together. Each high priority opportunity must be converted into a shared outcome. In the traditional strategic planning, a vision provides that focus. Visions sometimes don't work so well in partner collaborations because each organization has its own vision and mission. In most cases, a vision is a little bit vague and impractical. To engage people in partnerships, we need clear, concise, measurable outcomes. Clarity enables people to translate an outcome into their own mental model and into their own mission and vision. When we pull people together in states, either at the state level or at the local level, we have a basic approach we use. After introductions are made and people have met people that they didn't know and reacquainted themselves with others, we talk about the WIOA vision for the state level and for the local level. We also talk about any state, regional, or local objectives that are already established. We explained the integration continuum and the major processes examples, things like intake, orientation, assessment, career services, case management, career pathways, business services, and the like. Everybody gets into smaller groups and works on the integration continuum assessment. And in those small groups, they say together and decide where it is they're at and where they'd like to be. Each group identifies 2 or 3 areas they'd like to work on locally this year. Each group identifies priority activities for the coming year. So not just the areas, but specific actions they can take. Then they come together in a large group and report out, share their priority areas and proposed activities, and consider how well they match up together and if there's common viewpoint on that. And then they look at what they might do at a regional level. Usually at this point, they coalesce as small groups in the larger whole with a set of strategies and key objectives they want to accomplish to meet goals they have established in the moment. And then they work on implementation considerations. They look at issues around their capacity to accomplish what they have said they'd like to do, identify areas where they might need assistance, and consider who might be able to provide that. And they debrief with next steps. So as they come out of the meeting, they have identified their priorities for the coming year. They have some initial action plans and action steps on how they're going to accomplish that, and they work in teams to do that throughout the year. Here's an example of service delivery. This slide is used to illustrate one aspect of service delivery shared by all partners can progress from one level to another to reduce duplication with a team that's planning to go from communication to collaboration and career services. So this team decided they were at the communication level. They were informing partners of career services and resumes and workshops and things like that. And they wanted to move to collaboration where they can maybe meet cross-agency with customers to develop their specific employment plans rather than having one single individual having 2 different employment plans and job goals with 2 different programs, working together and developing those, including utilization of career services within those plans for those individuals who are co-enrolled with one another, for those individuals working with 2 titles or more. WIOA authorized career services for adults and dislocated workers rather than core or intensive services authorized by WIA. 3 basic types of career services. Basic career services. This is an initial assessment of skill levels, including literacy, numeracy, and English language proficiency, as well as aptitudes and abilities, including skills gaps, as supportive services needs assessed, labor exchange services, and provision of referrals to coordination for activities with other programs and services, including those within the one-stop delivery system. Really, this is something that most partners do. Most agencies have some process like this. And if that information can be shared back and forth, it becomes less duplicative in terms of staff time and easier for the customer than have to go through the process 2 or 3 or 4 different times. Career services also includes, for some, individualized career services, comprehensive and specialized assessment, development of an individual employment plan, and career planning. And then follow-up services. These services can be provided in any order. There's no sequence requirement for these services. Career services under this approach provide local areas and service providers with flexibility to target services to the needs of the customer. In the example, the team wants to move from the current practice of information, as I said, to one of cross-partner staff meetings regularly shared to develop specific employment plans. Strategic self-assessment and planning for alignment in action, Delaware. The State of Delaware Workforce Investment Board established a cross-partner team to do strategic planning on service alignment and worked with Mayor and Mayor on process flow mapping and with WinTAC on coming together to establish their strategic alignment baseline and their strategic priorities and planning efforts. They have created a website includes which includes housing their plan, resources for WINTAC on plan implementation, customer and business surveys WINTAC is conducting, and information on the strategic alignment work teams in adult career pathways, front-end services, business services, data sharing, and common intake. This is a screenshot of the Strategic Self-Assessment Planning for Alignment and Action in Delaware. The State of Delaware Workforce Board, as mentioned, has on their website information on their WIOA strategic planning efforts. It includes their service integration continuum assessment they did in conjunction with WINTAC, information on implementing a plan, and then specific information on the areas just identified: adult career pathways, customer feedback and complaint process, data sharing, common assessment, and the like. This website link is shared at the end of this presentation, and you can go in and learn more about how Delaware is approaching strategic alignment among their WIOA partners. Strategic self-assessment and planning for alignment and action in Illinois. Another state that took a state-level approach to the strategic self-assessment and planning for service assessment or alignment, rather, was Illinois. The core and required partners, under the sponsorship of the governor and the State Workforce Board, established statewide goals using the WINTAC process. Each of the local American Job Centers established 3 or 4 of the state's goals of particular interest to their local issues and priorities. Each of the one-stops also developed local action plans that roll up into the state plan using the agenda that we shared earlier for the meeting. WINTAC's consultation was on the statewide use of the self-assessment and strategic alignment planning process. We also provided a facilitator training, which was available to each of the American Job Center partners. In addition, WINTAC is providing technical assistance to 8 pilot areas in the prioritization, action planning, training, and consultation on implementation of their action plan. Like Delaware, Illinois has their strategic self-assessment and planning on their webpage. And here's a screenshot of that webpage. Integrating local workforce services for job seekers and employer customers is a priority of the Illinois Workforce Innovation Board because Illinois has many departments and programs involved in service delivery. Integrating these many resources is essential for customers to have a positive experience. The page shown provides links to local workforce innovation boards, one-stop operators, and various core and required partners are identified in the Federal Workforce Innovation and Opportunity Act. Understand service integration requirements, investigate effective practices, and engage ideas and exchange information. Information on this page is broken down into 4 areas. Guidance and forms, which includes Illinois' WIOA Service Integration Overview and Self-Assessment Guide. This assessment guide has been developed by Illinois Workforce Innovation Board, interagency team to help workforce innovation boards implement the state's service integration policy. The tool and the continuum model on which it is based were adapted from material developed by WINTAC, funded by the U.S. Department of Education. Along with the Facilitator's Guide for Local Service Integration Assessment Processes, the Workforce Innovation Technical Assistance Center, WINTAC, has provided other self-assessment facilitators, trainers, and others just mentioned. And again, the link to this webpage is at the end of this presentation. Self-assessment and planning. So, self-assessment and planning can lead to customer sharing and co-enrollment, building expertise in individual customer service and integrated resources teams is one example. Stronger career pathway models, including all job seekers, including those with disabilities, in responding to business sector needs, stronger job seeker service experience and service engagement, comprehensive services in a single voice. The benefits of customer sharing co-enrollment, braiding expertise in individual customer services helps individuals meet their needs, and that's what WIOA is all about. Comprehensive business services in an aligned or unified way is something the business tells us they need. Now, shared funding and administration of joint programs requires an approved plan. The unified or combined state plan provides for the designated state agency to share funding and administrative responsibilities with another state agency or local public agency to carry out a joint program to provide services to individuals with disabilities. So under WIOA and the Rehab Act, it is authorized to do these kinds of things. Of course, only allowable, allocable, necessary, and reasonable costs are charged to the VR program. VR programs also have to determine whether comparable services and benefits are available under any other program. And as we have seen, they are in many cases. Oftentimes, it is the case that such services can be aligned with one-stop partner programs in a way that does not interrupt or delay a customer's progress, but in fact enhances their programs towards achieving an employment outcome identified in the individualized plan for employment. Strategic planning maximizes the coordination of resources and the non-duplication of services and cost. Summary. The process of collaborative strategic planning for service alignment is a way of framing the approach to strategic planning for service alignment that is consistent with the requirements of WIOA and its aims for increased service integration among the core and required partners outlined in the unified or combined plan template. We have shared the concept of the integration continuum, how it's being used in several states. The process begins with conversation about the current level of alignment and results in an action plan to reach the vision determined for a more integrated service delivery model under WIOA. It also establishes a baseline for continuous improvement. But more than that, it provides an opportunity for practitioners to come together, people that are used to providing services sometimes by themselves, oftentimes in an overwhelming way with the needs of people that are coming in to see them. And many of those needs are the same across programs. A person of low income may also have a disability. A person with a disability may need basic education. When these services are sought by the individual alone in a confusing array of services, it does not benefit the individual, nor does it benefit any of the individual customers. With common performance measures, everyone is being measured on the same thing and shooting for the same goals and outcomes. By coming together, deciding how well or how poorly or how in between the local area is doing in regards to their service alignment, begins to open up the conversation for ways to improve, ways that will be better for the individual, ways that will make non-duplication happen, ways that will ease the system into a more coordinated, aligned state. These conversations can, with focus, come to very specific steps and outcomes that partners agree to. By coming together, working together, and hashing these things out, collaboration is already taking place. So the model itself involves people together, working together, and that can carry forward in increasing trust and also in working together to solve the problems they have identified. And it's a joint responsibility, come to willingly and with goals that are beneficial to all. These action plans, of course, need continuous improvement to go forward. So while WIOA says that the core partners and other required partners are to work together, it provides no structure or recommendations on how to go about that. This is our small effort to make those kinds of things available. As I mentioned earlier, there are some resources here at the end of the presentation. They include information on the integration continuum, including articles that were referenced directly or indirectly throughout the program. It also includes the links to some other resources that are on the WinTAC webpage and elsewhere. Also included in here towards the bottom is the Delaware One-Stop Web Integration page and the Illinois Service Integration page. Thank you for listening today.